walk through how students can receive the assignments in a customized view to manage their medication activities for patients they're assigned during clinical rotations. This is one of the most important competencies that we develop as nurses, is how to successfully manage the patients that we're assigned. As clinical instructors, we oftentimes assign students patients that they will care for the next day during the course of their clinical rotation. Because of the nature of healthcare, those assignments can and do change. And as nurses, we accept new patients as patients are discharged and transferred. And we also transfer and discharge patients, which requires some degree of dynamic synergy and again, optimized and customized views that ensure quality of care delivery and medication safety. So what I'm going to do from here is I'm going to select all patients that are available on the unit where care is being delivered. I'm going to select my patients, where you'll see one patient has already been entered for this particular student assignment, Lauren Black. Now, Lauren Black is actually scheduled to be discharged sometime around 10 o'clock tomorrow morning, which is, maybe 2 or 3 hours into the student's assigned clinical rotation for the day. So I actually want to give this student 2 more patients that they can be assigned. So I'm going to select 2 additional patients, and Danny Childs and Alan Fossil. So that's going to be the patient assignment for this particular student. Once I've selected all of these and they appear on the right, I click Accept. What Pyxis MedStation ES now affords me is a customized view of the 3 patients that I'll be caring for as a student during the course of this assignment, including Lauren Black, who's scheduled to be discharged. Now, this view also offers a viewpoint of what's going on from a medication standpoint in terms of scheduling. For patient Danny Child, there is a medication that's due at 12 o'clock. If I touch on the highlighted circle area, it pulls up the medication that's due within the time frame that the pharmacy has specified in terms of the window of opportunity. I can go ahead and cancel out of that if I want to return to the main view. But this allows me quick and easy access to the patients that I've been assigned as a student. It gives me a viewpoint of medications that are coming up from a schedule standpoint, but also from a PRN standpoint. And if I select an all orders circle, it pulls up all of the available orders for that specific patient, allowing me ease of access and confidence that I'm pulling up the right medication order set for the right patients that I've been assigned. So as students participate in their clinical rotations and care occurs naturally within the environment, patients will be discharged and transferred. The particular student that we're using as an example had 3 assignments today. One of those patients is actually scheduled to be discharged, so we want to modify the customized view available from the My Patient screen. So I'm taking a look at the current setting, and I'm going to edit the patient list for the assignments that I have. Pyxis MedStation ES then pulls up the 3 patients that have been assigned. Lauren Black is to be discharged, so I click on the X next to the name and then Accept. The customized view from the My Patient list now reflects 2 patients assigned and no longer includes the patient that was just discharged.